Welcome back to Valley Life. I'm Alicia Safias, and today we are going to talk to Dr. Scott Jett, a periodontist here in town, and he's local. He joins us right now. Welcome.
Thank you. Thanks for having me.
First of all, you have a huge background here in Fresno. Tell us a little bit about yourself.
The short story is that I grew up out in Centerville, east of Sanger, was a Sanger High grad, and went away to Auburn University after following a swim scholarship and a swim career there.
Yeah, a lot of people know you for your swimming background. Now, we are going to talk to a patient here, Danny, in a second, who is one of your patients and has a great success story. But what we're really talking about today is gum disease, and half of all Americans have gum disease, and we probably don't even know it.
No, it's true. It's the most common cause of tooth loss in America, probably the world. The tough thing about it is that most people don't know they have it because it's not painful. If you have a cavity or a decay or a broken tooth, you tend to know it and tend to go get help. For a lot of people, unless it's diagnosed by their general dentist, they often don't even know they have it.
And that's what happened to Danny here. But a lot of people like Danny are intimidated to come in because they hear horror stories, and you have kind of found a way to take away some of that pain. Tell us about that.
So the conventional way of treating gum disease is to use a scalpel and sutures to go underneath the gum line to open the gum tissue and clean it from the inside out. We can scale the roots, clean the debris, and re-suture the gum line closed. It's been around for 20, 30, 40 years and very predictable, but people tend to get afraid when you tell them there's blades involved, a suture, scalpels, those kind of things. So now we're using a laser, a real specific procedure that allows us to treat gum disease by going to the inside of that deep pocket that's caused by the disease and treat it with a specific wavelength that kills the bacteria that caused the process.
And you kind of compare this to LASIK surgery we'd have for our eyes, but you're doing that with our gums.
Yeah, the thing about a laser is it's unique. It has a wavelength that will seek out and either ablate or kill certain things. So lasers have been around for a long time. We use them for other aspects of dentistry, but this is specific because there's a very specific set of bacteria that cause the disease, and the laser itself treats the disease tissue while keeping intact tissue healthy. So rather than just cutting it away with a laser, which they tried 20, 30 years ago, we can now do that in a closed fashion without having to open the area with a blade.
Okay, Danny, and when you first got your diagnosis that you had gum disease, it was probably pretty scary.
Yeah, I put it off as long as I possibly could.
And that's usually what people do, the doctor has told us, is they're afraid to come in, and then it leads to tooth loss. Luckily, you caught it before that.
Yeah, I've had some bad experiences with dentists in the past, so I'm really not a big fan of pain in my mouth. And so I just naturally put everything off as long as I could. Before I came in, and my dentist finally told me that I just had to get it done. I couldn't wait any longer, so he referred me to Dr. Jett.
Okay, you came to Dr. Jett, and you actually were amazed that it didn't hurt you.
Absolutely. I was prepared for a lot of pain and bleeding and suturing and basically oral apocalypse from what everybody had told me. And I came in and talked to Dr. Jett, and he said the pain would be a lot less than what I was hearing, and he was right. I had absolutely no pain at all.
And we're only about a month away from your procedure, and you feel great, right?
Yeah, absolutely. I'm back to eating normal, and I don't have to watch anything except for I got a new routine for flossing. But other than that, everything's great, and I have no problems.
What would you say to people out there who were in your position, who are a little intimidated about coming in here?
I would say don't put it off like I did. Don't be a big chicken like I was. Just get it done.
Yeah, and it didn't hurt you.
Not at all.
That's great. Is that kind of a typical story that you hear here?
Yeah, that's what we've been seeing is that at 1 week, I tend to see patients and their reports are just amazing. So for me, getting to do what I do, it's a more fun part of my day to see these patients that I've done the laser on versus my conventional surgery patients, which we still do sometimes. They just seem to kind of come in with a smile rather than, you know, the fear and the concern that they had after regular surgery, which we can control with pain medications, but when I don't have to, it's just wonderful. And my whole staff is behind me. They're helping me stay committed and dedicated to doing the education needed to keep the technology up to speed. Being a leader is kind of scary sometimes when you're kind of the first guy doing something in an area. As far as our specialty goes, we're the only office in Fresno offering that.
And another thing that's unique about you, you do have this friendly staff and you talk about education, but you are telling people like Danny about maintenance and educating us how not to get to that point again.
Yeah, it's true. The general dentist does a wonderful job. And the offices that refer us patients, we really appreciate as they educate their patients. But typically a patient just hears nothing from that appointment. Sometimes they'll go, but all they remember is that you need surgery. So it's still a surgical procedure, but taking care of it afterward is key. Like whether it's diabetes or high blood pressure, the patient has to take some ownership of it. But if we educate them, if they come to get to know us and they know that we're an advocate for them and we want to help them get healthy, then they tend to, and people actually start flossing.
Right. Well, we'll keep that in mind. Thank you so much again, Dr. Jett, for keeping our gums healthy. Again, you can come here for a consultation anytime. And Valley Life will be right back.